welcome to all the guests who are here. And my name is Subash, and my background is I'm a clinical applications pharmacist. And my area of work has been since last more than about 20 years into eye drops, uh, and especially why they are so much important in quite a number of disease area where eye drops are prescribed. Thank you. I'm starting to share my uh, presentation. Okay. What I call this is the story of drops. And I like to put this slide before you because life-saving drops are raindrops. And of course, we have snow right now, but the rain is very important. But sight saving drops is eye drops. Now, eye drops medication, there are many different conditions where eye drops are prescribed. For example, glaucoma, cataract, dry eyes, and ocular allergies. Now, drops medication for glaucoma, which is most prevalent form of preventable vision loss condition, and they're the first line of, they are frequently the first line of treatment options. They are used to decrease the pressure in the eye, and even if the pressure is normal in some patients, it is important to reduce it to help to stop the deterioration of the vision. Now, what do you mean by pressure? Pressure is actually, the eye always has got a fluid coming in from the ciliary membrane. It gives the wash in the front of the eye. It is a clear liquid which contains oxygen as well as the nutrients to help the eye, as well as it maintains the shape of the eyeball. Now, when it comes in, it has to go out. For some reason, and it has to go out, so ciliary body produces it, and trabecular meshwork, when you look at your eye in the mirror little closely, you might find near the pupil sort of a very, brown eyes or green eyes or blue eyes. You'll find a sort of a network around your pupil, and that is the trabecular meshwork from which the liquid goes out. And if for some reason the incoming liquid is more and the outgoing liquid is less, then the pressure builds up. This intraocular pressure or eye pressure has got no relationship with blood pressure. You must remember that. So when you go for an, say, eye examination to your optician or even to the hospital, well, when you go to the optician, they throw a bolt of air, a puff of air, and that measures the pressure. Now, the pressure is considered, after long research, the doctors and everyone has come to a conclusion that pressure at 20 is the normal. Anything below 20 is lower pressure. Anything about 20 is high pressure. But depending upon the structure of the eye and the genetic condition of the particular patient, the effect of this particular pressure will be detrimental onto the optic nerve. And that is why when the pressure is measured, when visual field test is done, and if your doctor finds out that there is a deterioration of the vision and the pressure has to be brought down, they start giving the eye drops. Now, either pressure can be lowered in two ways: either decrease the production of the fluid or increase the outflow of the fluid from the anterior chamber, which shows in the diagram here, from here. So this is the ciliary membrane where the fluid comes in, and this is where it goes out, and from the anterior chamber. And there is a combined approach of joining both the drugs together to help maintain the pressure in the eye. Now, it's very important the patient's adherence to the recommended treatment regimen remains a key challenge. Believe you me, my work in eye drops have found out, if every time I've stood before an audience and asked them, there's always a little problem. People, when you have to put something in the eye, you don't know how to put it in the eye. Sometimes it stings. And people feel that I have no problem with the eye. Why should I be putting this eye drops in my eye? So in glaucoma, actually, it is estimated that non-adherence is as high as nearly 59 to 60% among the patients using the eye drops. And that's very detrimental, because if you don't use the eye drops, your pressure will increase and there will be vision loss. So eye drops are first line of treatment. It is a modifiable option for reducing the intraocular pressure. If you look at this slide, the therapeutic range, if you look at the medication, it's a very big range of medication which the doctors have access to. Now, you must remember that any eye drops prescribed to you is actually tailored to your needs. So that is very important to remember. Now, when I say about my eye drops, why do I take them? We take them to control the intraocular pressure. How do they work? I told you earlier, by reducing the inflow and improving the outflow. And now here is where the problem starts, because when you get prescribed eye drops, actually, and I'm sure that the audience will agree here, that nobody shows you how to put the eye drops in. So you have to use the correct technique. We'll come to that as well. And the last one is, when do I put them in? There are eye drops which the doctor will tell you, oh, put it going before you go to bed, or it takes twice a day, or 3 times a day, or 4 times a day. So we have to remember this dosage system as well. So you put the drops at the recommended time to get the best outcomes. Now, when you look at the progressive visual field loss, where do we want to be? You know, in this particular slide, you'll see that there is a normal vision field. And for glaucoma patients, when the intraocular pressure increases and it is not being controlled, you can see these darker sides, and this is the area where the vision loss occurs. On the right-hand side, you'll see all the different eye drops which are available. And these are the tailored for your particular need. So when you take it at the correct time and with the right technique, that you can control the intraocular pressure and prevent the further loss of the vision. Now, this is normal for everybody. You, me, the audience here, everybody in the world. We have got what we call it a circadian rhythm. Now, intraocular pressure throughout the day has got ups and downs. Now, if you look at this particular slide, and this slide is from a professor from Rome, and he has done quite a lot of research in seeing that the intraocular pressure increases at the early hours of the morning. Now, why I want to show this particular slide here, that there is a drug, prostaglandin drug, which is being prescribed, which is the first line of treatment which is prescribed to lower the eye pressure because it improves the outflow. And this drop has to be taken around between 9:30 and 10. The doctors tell you put the drops before going to bed. True, but everybody goes to bed at different times. When I have asked people, oh, I don't want to go to bed right now, so I'm not going to put my drops in. If I put my drops in right now, I have to go to bed. You see the problem here? But it's not like that. If you put this drop between 9:30 and 10, it gives you the best of effect of lowering the pressure, which is there early in the morning. And after putting in the drops, you don't have to go to sleep. Sit there quietly for 5 minutes, then you can watch your TV, read a book, go to bed at whichever time you feel like, okay? Now, let's come to use your drop correctly. Remember this, drops are for life, especially for glaucoma. They slow down or stop the deterioration of the vision. They cannot reverse the process, but we are here to arrest the further loss of vision. Take them at the correct time every day, get into the habit, and develop a good technique. Okay, right. Well, I say walk this way. Walk means not that Chinese walk where we cook our vegetables and the food. This is wrist on knuckle, which is the simplest way of and the easiest way of putting your dry eye drops in, where you can really target your eye properly. You don't touch eye. You can see this from this photograph. that I have got my fist. There's another slide which will be following, which you'll be able to see. But here you can see my dominant hand is right hand, so I'm holding the bottle upside down in my right hand. It is resting on my wrist, and I've pulled my lower lid with my knuckle of my hand. So everything is clean, everything is away from my eye, and you can put the drop in correctly. These are 4 photographs you can see, which I show you how to put the drop in. In the first one, I'm preparing my fist by putting my thumb on my palm and folding my 4 fingers on it. So my thumb actually pushes my middle finger up like that. I have got the bottle or the single dose unit in my dominant hand with the nozzle pointing down. In the right hand side, you'll see I've turned the fist towards my face, and then I put the hollow of my fist just under my eye and pull my lower lid with my knuckle and rest my wrist of my hand, which is holding the single dose unit, and I can just put the drop. You require only single drop, which goes into my lower eyelid. Simply, if you have to put in both the eyes, you just shift the hand from, I've shifted my hand from left cheek to my right cheek. Once I've done that, never ever blink it. Because if you blink, then you push about 20% of the liquid through a passage between the eye and the nose, which is called nasolacrimal duct, and 20% of the liquid goes inside our tummy, which we don't want to do it. This dosage is small, but it has got its own side effects if it goes into our system. So very simply, what I've done here is, close your eyes gently and find at the corner of your nose, right at the bottom, at the corner of your eyes. If you feel it, you'll find 2 little bumps there, both the sides. And this is actually the opening which goes into your nasal system. You just press it there gently for about a half a minute or a minute, and that will prevent the liquid going inside your system. What we call in medical terminology is occlude the puncta, or close the tear duct. The dose of the drug in the eye drops is low. It can get into the system. So shut your eye after putting in the drop. Don't squeeze, just shut your eye and occlude your puncta, like my colleague is showing here, right at the corner of the eye. For those people who have dexterity problems, like, if you've got rheumatoid arthritis, you cannot put the drops in correctly. So there are quite a number, in this picture, you'll see there are quite a number of different aids which are available. So you'll get this help and the aids actually from the ECLO. When you visit your hospital, please ask for ECLO, or Eye Care Liaison Officer. They have all this in a sort of a demonstration pack, and they will be able to actually give you and recommend you the right one, which you might need. Let's come to cataract. That was for glaucoma. Quite a large number of patients these days, and they go through a cataract operation. And after the cataract operation, you can see from this slide, there are 2 drops which are prescribed, which are very essential. This slide is actually from Oxford University Hospital, from my good friend, Dr. Gurjit Singh from there. And what he has designed here is your eye drops regime is as follows. The following drops should be applied to your operated eye only, starting the morning after the surgery. Very important to know. There are 2 drops which are being prescribed. One is chloramphenicol. This drop can be stored in the fridge. The time for dosing is 1 drop 4 times a day for 2 weeks, and it is an antibiotic to prevent infection. Second drop is dexamethasone, which is a corticosteroid anti-inflammatory known as Maxidax, which is preservative-free. It is 1 drop 4 times a day for 4 weeks, then you have to stop. And it is an anti-inflammatory. Now, here there is a problem. You've got 2 different drops 4 times a week. Okay? Always remember, if you put your chloramphenicol drop first, then you have to wait for 10 minutes then put the dexamethasone drop. If you do it one after another simultaneously, the second drop will actually wash out the first drops. We don't want that. So when you have two regimens, two different drops like this, put one, wait for 10 minutes, put the second one in. So when putting the eye drops into the eye, do not allow the bottle tip to touch your eye, which I showed you in the first slides as well. You can use that wrist upon knuckle technique, walk technique, and do not allow other people to use your eye drops. Very important. And once you finish your bottle, please throw away the bottles. Right. Now, we have discussed two things, glaucoma eye drops, then we have got cataract eye drops. Now, we are coming to something called dry eyes. Now, this is another, since the pandemic hit and our usage of actually the screen has increased. Believe you me, out of 24 hours, we actually use about 11 hours. You get up in the morning, the first thing you do, take your phone and look at it, isn't it? Then you got the TV, then you got computer work and all. And in this thing, what has happened is our blinking rate has dropped down. So we use our screen time for nearly 11 hours and our blinking rate has dropped by 50%. Now I'm coming to the blinking rate, why it is so important. What are the common symptoms of dry eyes? We have got sore, gritty eyes, stinging and burning, watering of the eyes. People ask me, if my eyes are watering, how can it be dry eyes? No, watering of the eyes is actually a symptoms that you got a dry eye. Irritation from the air conditioning or wind. When we go out in winter like this, and if there's even in summers, when it is high wind and all, our eyes actually tend to evaporate, and that causes dry eyes, red eyes of the eyelids as well. I'm not going to go through this very complicated. It's not very complicated, but dry eye disease is recognized as a disturbance of the lacrimal function unit. I'm not going to give you very technical jargon. Actually, what happens is every time we blink, our eyes produce a tear film. Okay, and this is lacrimal functional unit. That means it has got, in that tear film, you've got three layers. Our eyes produce these three layers. The nearest, which is sticking to the eye, is produced from the meibomian gland and is called a lipid layer or sticky layer. Then there is this tear watery fluid, which has got oxygen as well as nutrients for the eye surface, is the aqueous layer. And the outside layer is an oily layer. Why? And honestly speaking, the nature has designed this so perfectly well that every blink washes the eye, takes away the debris, and provides this film. The only problem starts when this film is disturbed by either the eye drops, which contains, say, sometimes preservative, which causes problems. Air conditioning, yes. Heating in the house right now, yes. Heating in the car, yes. Walking out, having a huge breeze outside, yes. So all these things we have to remember that they cause dry eyes. So if you have got any burning, itching, watery eyes, that means you've got dry eyes. So how do we deal with it? So first of all, we have to look after the eyelids first. Now, every time you go to the washroom, see to it that you wash your eyes, close your eyes first. That is very important. And wash your eyes with warm water, which you can tolerate, from eyebrows downwards towards your cheek by gently pressing on the eyelid margin. That will clear off any debris which is there in your eyelashes as well, and it cleans your eye. It's about the surface of the eye, including the eyelid. And believe you me, if your eyelashes are blocked, there are small little holes under the eyelashes, which are known as meibomian gland duct openings, which produces that lipid layer and the oily layer as well. So if they are blocked, then the bacteria will go in and it will start causing problems, and which is known as blepharitis. So eyelid margin health is very important. So if you wash it with warm water or tolerably hot water with a flannel cloth or a clean cloth, remember, close your eyes, wash it from downwards towards your cheek by applying gentle pressure, and it will clear eyelid margin, and it will be. This is a program in also ongoing dry eye management program. But we still need to get that film back to its normality. So your doctors will prescribe you what we call is lubricant eye drops or artificial tears. Now we have to remember one thing. There are lots and lots of them are available, but they should be preservative free. That is number one. Supermarkets sell them from £1.50, but they contain a preservative, which actually is detrimental to the dry eyes. It causes more dry eyes actually. So see to it that you have a preservative-free eye drop. Choose preservative-free. It got a substance called hyaluronic acid, and it also has a bioprotectant now. They're easy to use. They come in 10 ml bottle, and they last you for nearly about 2 to 3 months. These drops can be utilized anytime. You feel uncomfortable, you use them. You know, I use them when I go on long drives, when I go to work and I have to drive on motorways, and I forget to blink actually, and that causes my dry eyes. And then there is an air condition in the car, or the heating is in the car. So I tend to use my eye drops before I drive off. So these are the certain precautions you need to take. So please get the eye drops, lubricant eye drops, which are preservative free, contains hyaluronic acid, has a bioprotect. They're easy to use and they're quite economical as well. Use eye drops correctly. For glaucoma, drops are for life. They slow down or stop deterioration of vision. They cannot reverse the process. Take them at the correct time every day. Let the drops perform at its peaks. Get into the habit. Develop a good technique. Please refer to those pictures. And if you want them, Bhavini will be able to send it to you. This presentation, as well as this printout of that, how to put the drops in, is available. So that is a good technique. And don't forget to press lightly at the corner of the eye to prevent drops entering your system and get the maximum benefit. Thank you for attention, and let's have the questions.
Thank you, Subash uncle. Just whilst we're still recording, if you stop screen sharing, so your screen is center, if you could just demonstrate the walk, wrist on knuckle procedure again, okay. Very slowly, and describing exactly what you're doing. I think that would be very helpful.
Sure. I can actually, if you can enlarge my picture, then I will be able to show it, actually perform it just before you. How do we do that?
Your picture is actually really large, so you're actually in the middle of the screen now.
All right. Oh, that's great then. Thanks. All right. So just give me a second. I'll just go and get a bottle so that I'll be able to say. Just give me a second.
Yeah. So for those that are just joined in, we're just going to demonstrate the wrist on knuckle demonstration that Subash uncle did in the presentation, which shows accurately how to insert your eye drops.
About that, I should have had the bottle with me before that. Okay. What I call is walk. This wrist on knuckle. I'm a right-handed person. My dominant hand is right hand, and this is the lubricant eye drop bottle which I have. Always see that your hands are clean, and your surface where you put your eye drops bottle cap should be also free, or put up a tissue and you can put that over there. Now, just keep on looking at me. With my right hand, which is my dominant hand, I hold my bottle with my 2 fingers and thumb, but I invert it like that. So the nozzle is actually parallel to my palm. Can you see that? Okay. With my left hand, I put my thumb on my palm and close my 4 fingers on my thumb. And you can now see that my middle finger knuckle is a little bit pushed up by the thumb inside. Okay. And my fingers and my palm actually now has got a little bit of a hollow. Now, what I do is I put my hollow on my cheek here, like this. And with the help of my knuckle, I'll put the lower lid down. Always remember to put the drops in the lower lid, because that's where it forms a little bit of a pocket and the drop actually falls inside that. You need to have it there. So now it goes like that. Then I rest my wrist on my knuckles here. And now you can see I can adjust the angle of my bottle to put the drop straight into my eye. There it goes. And then if I have to put it to my second eye, I just move my wrist from my left cheek to my right cheek, and there goes the drop. It is as simple as it requires a little bit of practice, but believe you me, you'll get it fast. I have actually taught people in an audience within 5 minutes, actually everybody is able to put the drop in. Once you put the drop in, gently close the eye, and right at the base of your nose, at the corner of your eye, feel those two little bumps and just press it gently for about half a minute or a minute. That will prevent the liquid going into your nasal system.